Welcome back. You're watching Channel 1 News Hour, and of course we are now focusing our discussion on your health segment, looking at particularly issues that touch on immunization. But before that, a quick reminder of our opinion poll question tonight, stemming from events that took place in Parliament. National Assembly members of Parliament saying perhaps it is time for them to consider disbanding the Senate, accusing Senate of duplicating their role and of course usurping their powers. And we are asking you tonight, do you agree with the National Assembly MPs that the Senate should be disbanded? 22162 is the SMS line. Keep speaking to us. We will sample those views later on in this broadcast. But for now, let's shift focus to health matters. And our guest in studio this evening is Dr. Collins Taabu, who is the head of the National Immunization Program, and we'll be looking at the current initiative by the government to at least increase the number of children who get immunized in the country in the next 100 days. Thank you very much, Dr. for coming to our studios. Thank you. Before we talk about, the initiative that is currently ongoing, in terms of the uptake of immunization in the country, what is the progress so far?
The progress was, for the uptake of immunization in the country, we have done well so far. We have had teething problems, we have had a few challenges, but by and large, 4 in 5 children in the country receive all the vaccines by their first birthday. In the last year that went by, 2017, we had a bit of a significant challenge in that we had a prolonged health workers strike.
Yes.
Now we had a significant drop in immunization in that we went down from 4 in 5 children getting vaccinated to about 3 in 5 children getting vaccinated.
That's a big number.
It is a big number, and it puts us at risk of contracting very serious vaccine-preventable diseases. We're talking very serious diseases like measles, we're talking polio, we have tetanus, we have hepatitis, whooping cough, so many other diseases that would otherwise wipe out our children.
So what is your plan to increase the number of people who are getting immunized?
We have a holistic plan as a country. First of all, the country leadership is seized of the matter. On the 27th of June of this year, we had His Excellency the President leading the country in committing to deliver the 5th child to immunization, together with the Council of Governors, and had several governors in attendance. So together they made a very strong statement to say, look, we need to get back the children that were missed in the last year by vaccines, to get them vaccinated so as to protect them. And we were asked to get these children vaccinated within the next about 100 days. That ends in October from the 27th of June. We were also, as a ministry, as a national immunization program, asked to work with the county governments and to work with the Ministry of Education to ensure that all of our children get vaccinated before they join school. Remember, in school the children are together, they're in communities which then diseases can spread very fast. So we want, as at the time when we are offering them the benefits of free primary education, as at the time when we are offering them the benefits of free health care for children under 5 and every other benefit that is brought about by this government, we are assuring their survival by having protected them from these dangerous diseases.
So between now and October, what is your strategy to find those children who you missed during that period when there was, the prolonged health worker strike?
Thank you. So we have various strategies that we have put in place. One of the big things that I did not talk about that happened on the 27th is that the government made this huge investment in terms of vaccine storage equipment.
Yes.
And we're going to have, for the first time ever in the history of the country, all health facilities being able to offer immunization services. That is, we're going to equip above more than 3,000 new health facilities with vaccine storage equipment. That means communities, families that otherwise did not have access to immunization, now having access to immunization and therefore being able to protect their children. As we do this, we have mapped out communities and we do know where these children that we missed are fairly well, which counties were most affected, and even within the counties we have a fairly good idea about where they are.
So how many counties were most affected during that period?
Basically the whole country is affected, but the bigger effect was in the rural counties, because the largely urban counties, Nairobi, Mombasa, Kisumu, had an alternative of private healthcare providers providing an alternative during the doctor strike. So the largely rural counties were very highly affected. So what we're doing is we're having a series of accelerated outreaches in these rural areas beyond the provision of medical equipment to be able to reach out to these children.
So you're going
and
door
offer
to
them the
door?
vaccines. Not door to door, but bringing the services as close as we can get to the communities themselves. So we got a community settlement that has a huge number of unvaccinated children, and mobilizing them to this vaccination center. The vaccinators would pitch tent either in a church, in a school, or a communal gathering within that community to be able to access these children. But with these, again, we're passing messages through our community mobilizers. We're passing messages through the media to be able to mobilize communities, caregivers, to bring their children for vaccination.
Of course, one of the issues that has been coming out a lot during, this particular immunization period and the vaccination period, if you like, is the safety of the vaccination. A lot has been said about it.
Yes.
How safe are these vaccines? Because there are parents who are coming back to complain that, their children are falling sick after getting this immunization. So what is the safety?
I appreciate that question, and as a program we are happy that these concerns are coming up, because then it gives us an opportunity to engage and an opportunity to debunk the myths around vaccines. First of all, I would like to point out that the Ministry of Health has an elaborate safety program for vaccines and all drugs in general. For vaccines specifically, we have what we call the National Vaccine Safety Advisory Committee, an independent committee of specialists that do not work for government but in academia, professors, lecturers and all that advise the government. We have a system in place that does collect data on safety of vaccines, that if you have a mother having a child that has reacted or that has had an event reported after vaccine, that they're able to report back to that health facility, and data is collected immediately and transmitted to the national level for investigation. We have had concerns arising from the just concluded polio mass vaccination campaign.
Yes.
That is different from this vaccination initiative that we're going through. But of note is that this is for the first time that these concerns are coming in. They've not been reported with previous polio mass vaccination campaigns.
So have you begun investigations into what really is happening? Yes,
we have the data. The investigations are ongoing, but we have the preliminary findings that unlike the previous polio campaigns, for which the same sentiments were not reported, we have this campaign happening in July, which is the peak of the flu season really for our country. If you look at the biggest pattern really of the complaints were really flu-like symptoms, a bit of fever, a bit of vomiting, pains and so forth from these children.
Yes.
So we have this campaign that has happened at the peak of the flu season. So the interaction of mothers, the interaction of caregivers, the interaction of vaccinators around this period of vaccination could easily have heightened the spread of flu, and that might easily, as caregivers, of course, they're concerned, the immediate thing they remember is the vaccine have been given, and heightened concerns that, look, could the vaccine have caused this flu-like thing, or so to speak. So the investigations are ongoing to see if there's any emerging new trend from the vaccine, but nonetheless, the vaccine has not been associated in the past with such side effects before.
So you're linking it with the season, the July season, the cold season.
Catherine, what I would say is that I'm linking it to the season. And I'd like to point out that just like any other event in our lives, having a mass vaccination program go on at any particular time does not preclude you going through a certain health event. There would still be other health events that would go on. Maybe it's a malaria season for those in places that have unstable transmission of malaria. Maybe it's a flu season for the places that have experienced winter-like conditions for us, like in Nairobi and so forth. So the mass vaccination exercise might come in the background of some of these, and sometimes it's so hard to be able to distinguish what is a true reaction of a vaccine and what is a coincidental finding related to a health event an individual is going through, in this case, which we've alluded to. But nonetheless, we're looking through the data, and most of these children have had investigations done, and we will be able to share the final findings later on. Yes.
All right, even as you talk about that, there's also this thing when we talk about vaccination, there are those parents who will tell you about the baby-friendly versus, the one which they call the government vaccine. I mean, what is the difference? Is it that, the one that they call the government has, the side effects of, the fever and the like, but this one which is being called baby-friendly is being packaged and is coming very expensive to parents?
I would like to debunk that myth, the baby-friendly versus what is being called the government vaccines.
Yes.
It is not true that the government vaccine has more side effects than this, what is perceived to be baby-friendly vaccine. On the contrary, whatever is being considered baby-friendly might actually have other excipients added to be able to sort of like lessen what is considered to be a side effect. And for all we know is that these excipients that may be added might actually reduce the effectiveness of the vaccine. So that you may find what you're calling baby-friendly vaccines may actually, in some instances, even may be less effective.
So are you saying the baby-friendly one is likely to be less effective? Because that is a very phenomenal statement you're making.
I am saying it is a myth. And some of those things we do to the vaccines to make them baby-friendly might actually interfere with the effectiveness of a vaccine. And they've not been really scientifically proven and scientifically tested. I would call it a marketing strategy, a marketing kind of approach, really, to call it like that. Nonetheless, I would urge all Kenyans to get their children vaccinated with effective vaccines that are provided through our routine immunization system. Just to give a bit of background again, there's this misnomer that this is available in the private sector and this is available in the public sector. The government of Kenya provides vaccines free of charge, or rather, let me say, at no cost, because the government taxpayer bears a cost of 4 billion shillings every year to be able to provide these vaccines. We provide these vaccines through a network of about 7,500 health facilities, more than almost half of which are private health facilities, and we'll still be able to provide the vaccines through them free of charge to the Kenyan child. So there is no misnomer like government and then private. I think it's a misnomer. Yes.
So it's a choice that you have to make as a parent.
It's a choice that you have to make as a parent.
All right. In terms of engaging stakeholders, because you've said you're going to the communities and you want people to get their children immunized. We've seen what has been happening with religious organizations, the churches. Especially what happened with the tetanus vaccine. The question of how safe is this, and to what extent are you engaging stakeholders to support this particular initiative? Because if my church elder tells me this vaccination is not good, the government is trying to do ABC, it is likely that many of the followers will not come for this vaccination.
Yes, you are right. And like I said earlier, the concerns raised by the religious groups and many other people allow us an opportunity to engage. So it's a good thing that the dialogue is ongoing. But one thing I'd like to point out before I come to that point is that over time, the immunization program has been the most successful public health intervention. That we have been so successful that the diseases we have been preventing against are now no longer being seen. We no longer see debilitating measles outbreaks. We no longer see people being taken to rehabilitation centers because they've suffered polio. We no longer see people having to be confined to dark rooms in hospitals because they've suffered tetanus and having their teeth extracted to be fed. Why? Because the immunization program has been that successful. Now, because these diseases are not quite there with us now and we continue vaccinating, the focus really has shifted much more from really the disease prevention aspect, and people are beginning to really question the safety of the vaccine and being blind to what the vaccine has actually brought us through, that we have been able to prevent so much of calamity. So that is one aspect. The second aspect is that, of course, the religious leaders, being custodians of the community's interests, definitely have a right to engage on behalf of the community to safeguard them. So we engage, we have fora in which we engage the community leadership. We have civil society engagement forum. Every time before we have a mass vaccination campaign, for those of you that will recall, we have a meeting with professional associations and have an engagement forum with the civil society, the media, and other religious organizations to be able to discuss these. And now, more than ever before, we have an arrangement where we're able to to interrogate the safety of the vaccines, or the safety of the medicines before they go out. This is in addition to the existing mechanisms to assure the safety. We have the international mechanisms through the World Health Organizations. We have our own national mechanism through the regulatory body, the Pharmacy and Poisons Board and the National Quality Control Labs. In addition to that, I talked about a national vaccine safety advisory committee that is independent that does this, and we continue to collect safety data through the mechanism I talked about, adverse events following immunization monitoring, that we continue to monitor safety data even going forward, even in the absence of those concerns.
Okay.
Yes.
I'm informed our time is up, but in terms of what are the crucial vaccines that any parent should ensure their child gets before the age of 5?
We have
the ones that you're really focusing on in this 100 days.
We're focusing on all the vaccines. We have 13 vaccines currently on offer in the routine immunization schedule. And by the way, we have vaccines that even prevent against cancer. Hepatitis vaccine prevents against cancer of the liver. We're soon introducing the hepatitis B vaccines. So all of the vaccines in the routine immunization schedule, if a parent was not able to get them earlier on or was missed out during the strike period, we urge them to really bring their child to the vaccination center or during these mass exercise to get their children vaccinated. So
the children have to be under 5 or below the age of 5, or what age are you talking about when we say children?
They do not have to be under the age of 5. Any child who has missed the vaccines due to them should be brought for vaccination. Of course, there are some age limits for some specific vaccines. For instance, the rotavirus vaccine for diarrhea may not be given to a child over 2 years of age. We may have the pentavalent vaccine that may not be given to a child beyond that age, but that discretion is made by the health worker. Is not something that we advise the parent to make the interpretation out there in the community, that we seek the specialist advice of the health worker as they present the children for immunization.
So in terms of access, should they go to the health clinic, or they should wait for you to come within the community? Because
they should primarily take their children to their nearest health facility. As it is now, the government has moved to ensure that all of our health facilities are able to offer immunization services, so they should be able to present their children there. They should also, in case they live very far from health facility, we're organizing series of outreaches. They could be able to present their child to an outreach post that will be communicated to them from the local public health office at the sub-county and county level, and on those specific days.
All right. Our time is up, but I just want to quickly ask you, the malaria vaccine, has it already been rolled out? The trial basis that you will begin?
Yes. It is not a trial.
It's also a pilot.
It is a pilot. It is a pilot because this is a vaccine that has been developed for us, and it has been developed by us in our own setting to be one of the biggest interventions alongside the nets and other interventions to prevent malaria. We're looking for the rollout of the vaccine in a pilot phase next year. And the big
so it's not in July this year, it's next year?
It's next year. It's been rolled back because we're looking really at our state of preparedness. So we're looking at the feasibility, because it's a new vaccine, of being able to deliver the 4 doses of the vaccines that are required to offer sufficient protection in the routine immunization schedule. So once we are successful with the pilot, then we will have consideration to roll out the vaccine to the whole country. All right. Thank you, Dr. Unfortunately, we've run out of time, but we do appreciate you sharing with us what you're doing and the importance of our children getting immunized at this particular time. Well, this is where we have to wrap up Your Health. Dr. Collins, Taabu, the head of the National Immunization Program, was our guest in studio. And of course, remember, it is important for you to take your child for vaccination in case they missed any of those stages. He says it doesn't matter how old they are, but just ensure that they have all the 13 vaccines that are going to help them as they grow up. This is where we put a cap on the program, but Brian Kimani will be up next with the day's business, so stay tuned.